Let's face it guys, getting older is a privilege, but it comes with a few curveballs, and some of those curveballs might show up in the bedroom. As we age, it's perfectly normal for our bodies to change, and that includes our sexual health. Don't sweat it though, because knowledge is power. Understanding these changes is the first step toward addressing them and maintaining a fulfilling sex life. You might notice that things aren't quite as spontaneous as they used to be. Remember those days when just a thought could trigger a reaction? Well, now it might take a little more, shall we say, direct stimulation. And hey, that's okay, it's just part of the natural aging process. But here's the good news. Age doesn't have to be a buzzkill in the bedroom. Stay tuned, because in the following sections we're gonna break it all down for you. The science, the solutions, and the secrets to a lifetime of healthy, satisfying intimacy. Okay gentlemen, let's talk about erections, the mechanics, the magic, and everything in between. Understanding how this process works is key to understanding why you might experience changes and what you can do about them. An erection, in simple terms, is all about blood flow. When you're aroused, your brain sends signals to the blood vessels in your penis, telling them to relax and open wide. This allows blood to rush in, filling two chambers called the corpora cavernosa, which makes your penis expand and become firm. It's like inflating a balloon, but way more interesting, right? Now here's where age can play a role. Over time, those blood vessels might not be as responsive as they used to be. But don't worry, there are ways to keep things flowing smoothly, and we'll get to those in just a bit. The important thing to remember is that erections are complex. By identifying potential issues and addressing them proactively, you can keep things running in tip-top shape. Let's talk about the elephant in the room, or should we say, the bedroom. Sometimes, changes in sexual health can be a sign of underlying medical conditions. Now before you jump to conclusions, remember that not every dip in your libido is a cause for alarm. However, it's crucial to be aware of the connection between your overall health and your sexual well-being. Certain conditions like heart disease, diabetes, and hormonal imbalances can directly impact sexual function. Think of it this way. Your heart is the engine room, and if the engine isn't running smoothly, it can affect everything else, including your performance in the bedroom. For instance, diabetes can damage blood vessels and nerves, including those crucial for achieving and maintaining erections. Similarly, heart disease can restrict blood flow, making it harder to get and keep an erection. Remember guys, taking care of your overall health is an investment in your sexual well-being too. Section 4. Lifestyle makeover for a spicier life. Simple tweaks, big impact. Alright gentlemen, now that we've covered the science and the potential health factors, let's talk about what you can do to boost your sexual vitality and feel like your best self, both in and out of the bedroom. The good news is that small changes can make a big difference. It's all about making sustainable adjustments to your lifestyle that support your overall well-being, including your sexual health. First and foremost, let's talk about exercise. Regular physical activity is like a magic pill for your body and your sex life. It improves blood flow, boosts testosterone levels, and helps you manage stress, all crucial factors for healthy sexual function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Think brisk walking, swimming, or even dancing. Next up, diet. A nutritious diet rich in fruits, vegetables, whole grains, and lean protein can improve blood flow, boost energy levels, and support overall health, including sexual function. Remember guys, taking care of your body is an act of self-love, and it shows up in all aspects of your life, including your intimate relationships. Section 5. Beyond the physical, nurturing emotional intimacy for stronger bonds. Now, let's talk about a crucial aspect of intimacy that often gets overlooked, the emotional connection. While physical intimacy is important, it's only one piece of the puzzle. True intimacy thrives on emotional closeness, trust, and open communication. Remember, the most powerful sex organ is the one between your ears, your brain. Emotional intimacy is about feeling seen, heard, and understood by your partner. It's about sharing your vulnerabilities, dreams, and fears without judgment. So, how do you foster emotional intimacy? It starts with communication. Make an effort to have meaningful conversations with your partner, beyond just logistics and to-do lists. Remember, building emotional intimacy takes time and effort, but the rewards are immeasurable. Section 6. Communication is key. Speaking openly about sexual needs and desires. Let's be honest guys, talking about sex can be awkward, even with a long-term partner. But here's the thing, Open and honest communication is the key to a fulfilling and satisfying sex life at any age. Think about it. How can your partner know what you want and need if you don't tell them? And how can you know what they're thinking and feeling if you don't ask? It's time to ditch the guesswork and start communicating openly and honestly about your sexual needs and desires. Start by creating a safe and comfortable space for these conversations. Choose a time when you're both relaxed and free from distractions. Approach the conversation with empathy and understanding, remembering that your partner might have insecurities or concerns of their own. When discussing your needs and desires, be specific. Remember, communication is a two-way street. Section 7. Taking charge, your journey to enhanced intimacy and confidence. As we've explored throughout this guide, maintaining a fulfilling sex life as you age is entirely possible. It's about understanding the natural changes, addressing any underlying health concerns, embracing a healthy lifestyle, and most importantly, nurturing a deep and meaningful connection with your partner. Remember, taking charge of your sexual health is an act of self-care and empowerment. It's about prioritizing your well-being, communicating your needs, and seeking support when needed. It's about embracing the journey of aging with confidence and continuing to enjoy a fulfilling and intimate life. Don't let societal stigmas or embarrassment hold you back from seeking help or having open conversations about sex. Talk to your doctor, communicate with your partner, and explore resources available to you. The most important thing is to remember that intimacy is a vital part of a healthy and happy life. So go ahead, embrace your sexuality and keep those sparks flying.